what we had been learned to yesterday, previous class. Till population control and role of nurse. Today we have to start with family welfare program in India.
Good morning, sir.
Good morning, Subida.
Good morning, sir.
Good morning, Daya and Jenny.
Good morning, sir.
Yes, Jennifer. Family welfare program. Look at this picture. Every family members together built a healthier family. Next, define family welfare program. Program developed well-being of individuals. What are the individuals? Child, woman, elders. Through family or through welfare measures. Example, child welfare, women welfare and elderly welfare. In India launched National Family Planning Program in 1951. The main goal of this program is that reduce infant mortality, IMR, control maternal mortality, MMR, minimize total fertility rate, TFR. So these are the technical terms used to IMR, MMR, TFR. Then 5-year plan and family welfare program. Every 5-year plan, the considerable measures taken by the government. For example, objective of 5th 5-year plan, birth rate 30 per 1000 should be bring down. By increasing integration of family planning services with health mainly maternal and child health and nutrition. New policy in 1977 name change from family planning to family welfare. So students, till 1977 the program name is that family planning program. After 1977 is named as family welfare. So nowadays the family planning is part of family welfare. So this question may be asked in competitive examination, okay? The change of name, program. Then functions of Department of Family Welfare. First function, facilitate antenatal services, antenatal and natal services for pregnant women. Second, implement postnatal program. Third one, provision of family planning services. Example, basket of contraceptives, condoms, mainly female male sterilization, surgical procedure, and counseling, etc. Fourth function is that implementation of UIP, Universal Immunization Program. As we know that, children's, after the delivery, every hospital given one yellow card, or you know that there is listed when give a particular vaccine immunization for first year, second year till 5 years, what are the immunization need and development, etc. Growth and development of children should be measured. Fifth one, surveillance, BPD, vaccine preventable disease. Sixth one, implementation of pulse polio program. So nowadays pulse polio eradicated from in India, so still going to prevent. Then implementation of PC and PNDT. PC means pre-consumption and prenatal diagnostic techniques, Act 1994. Then MTP, Medical Termination of Pregnancy Act. So mainly this pre-consumption prenatal diagnostic technique, which means this is an act to prevent sex selection. For example, modern technology use to identify the sex, maybe abortion within the womb. So which is punishable crime according to this legislation. Then MTP. This is a legislation explain about what are the condition abortion Okay, listed what are the conditions make abortion by a woman. The normal woman not allowed to do that procedure. Eighth one, coordination and activities, mass education, mainly media education, ninth one, procurement of specific vaccines. 10th one, monitor family welfare activities by NGOs. Release grant in aid. Students, as we know that maximum of family welfare programs as well as family planning through private hospitals, NGOs, non-governmental organizations. So family welfare department monitoring that program by private hospitals or non-governmental organizations. To grant aid means, for example, one hospital did a particular family planning surgical procedure or distribution of family planning material, for example, condoms. So this is report to the government. Government provide aid to that particular NGO. So this is so nowadays every private hospital provide free family planning services to every woman, every family. 11th function, facilitate provision of adolescent health services. For example, administration of folic acid in adolescent school and colleges. Administration of folic acid and other materials. Also other healthcare services to promote health of adolescent girls mainly. 12th function, capacity building. Building to mainly various category of health facilitators, training through training centers. Okay, these are the important functions of Department of Family Welfare. Then family planning. As we had been learned that family planning is part of family welfare. Definition: control the number of children and interval between the birth, particularly means of contraception, voluntary sterilization. Keywords: control number of children, intervals, between birth, then contraception, sterilization. According to WHO, family planning allows attain their desired number of children. Spacing and timing of birth, use of contraceptive, treatment of involuntary infertility. So this is added, infertility is treated by through family welfare program, family planning program. Infertility means a couple unable to bear a child due to various reasons, biological or other reasons. Women able to space, limit pregnancies, direct impact health and well-being. On the outcome of each pregnancy. So this is WHO definition. Keywords should be remembered. Look at this family welfare in India. Then scope of family planning program. First scope, proper spacing and limiting the birth. Second, advise sterility. Third one, education of parenthood. So which safe motherhood and childhood should be mothers, male parents should be educated, aware about fourth one, sex education. Students, which is very important area. The reason is that the family, healthier family need positive sexual knowledge to prevent family problems as well as healthcare problem concern. STD, communicable sexually transmittable diseases, to prevent. And educate about reality of sex. Fifth one, screening of pathological condition. Every antenatal mothers should be screened. For example, HIV test. Also blood test, urine test, is a very pathological condition should be screened before the delivery. Next scope is that genetic counseling. In India, genetic counseling is very, very important. The reason is that close relative marriages ended with sterility as well as congenital problem disorders may happen. Close relative marriages due to genetic factors. Other genetic problem is that color of the child. For example, a couple, both of them white in color, husband white, wife white, but both of them bear a beautiful black color child. What they feel? Husband and wife black in color, but child white in color. Child is black in color. Husband says that, maximum of families, this is not my child. So create problems between husband and wife due to that. So before the marriage, after the marriage, should be educate. Genetic counseling, color, what is the reason? For example, that may be derived from previous generation. Their own the husband, mother, or father, or wife, mother, or father, in white, black in color. That color may be next generation. So genetic counseling is very important in India to create awareness, to prevent problems in the family. Seventh one, premarital counseling and examination. This is also vital one. The premarital counseling means before the counseling, the marriage should be educated about sex education and problems. After the marriage, what are the problem may become, how to solve it. Also, examination is other area, physical examination. Some couple may be husband or wife may be physically not fit for sexual relationship. Due to sexual and the physical factors. The reason is that recently we know that many of the couples divorce within a month. This week marriage, next week divorce. Reason is that as the wife may be complaining, the husband not fit for sexual relationship with, due to physical difficulties. There may be this anatomical factors, etc. So before the marriage should be a physical examination need, which is next scope of family planning program. Then carry out pregnancy test. Then marriage counseling according to their cultural and religious background. 10th one, teaching home economics. Already we have discussed about this. How to use available resources in the family just way. Eleventh one, providing adaptation services. In some families or some couple unable to bear a child due to sterility, due to any problems for husband or wife. For example, sperm count may be less for husband, difficult to fertilize a child. That time, do not divorce, adopt the child from the orphanages legally. Legal adoption is very important. But somebody may be adopt illegally, which is punishable crime. So these family planning services provide this service to legally how to adopt a child. Then health aspect of family planning. First aspect is that women health. The women health have been measured by maternal mortality, morbidity of women, the time of childbearing, what are diseases may happen, morbidity. Then nutritional status. Fourth one, fetal mortality. These are the measures concerning the woman health. Before, I would like to ask one question. Blessy A,
Yes, sir.
can you define family planning?
The practice of controlling the number of children and the intervals between their births, the means of contraception
Yes,
or sterilization.
excellent. Thank you, Blessy. Yes. B, infant mortality, infant and child health. Infant and child health has been measured by child mortality, child growth and development, nutrition, then infectious diseases, intelligence. So in child health measured by, we know that IQ test. Some children may be mentally retarded. So these are the measures should be taken for infant and child health concern. Next, the welfare concept. First concept, small family norms. And nowadays slogan is that one family, one child. B, eligible couple, reproductive age 15 to 45. C, target couple, 2 to 3 living children. The target. Couple protection rate, percentage of eligible couple effectively protected against childbirth. The nursing role of nurse in family planning. The nurses are doing fundamental role, mainly administration and management of all family planning services. A, explain all available methods. For example, intrauterine devices, pills, how to administrate contraceptives. Next, surgical procedures. Then condoms, how to use, should be explained, all the methods. B, discuss effectiveness and benefits, drawback of each methods. Then how the user feels. Every individual, every mothers may having different likeness According to that, we can administrate the contraceptives. D. Explain chosen method. Say back, feedback should be asked from the couples. E. Clarify misunderstanding. A lot of misunderstanding in couples mainly in urban area, rural area. We are nurses responsible to explain about each and clarify, enhance the well-being in families for mothers and children. F. Work with woman and her partner. Provider of care. So it means educate to both husband and wife. G. Reinforcement of education. Motivate the family. H. Concern birth control methods. I. Build trust, acknowledge culture, religious factors. Student, this is other area focusing. The reason is that many cultural factors, culture and religious belief. Say some religion and culture not accept the family planning services. So we need to concern that factors and family oriented, religious oriented education and services should be provided. Family planning services. G. Address lifestyle. Style of living should be enriched. Healthy lifestyle should be promoted by the nursing professionals. As we know that after the marriage, a child bearing. Till the marriage, a woman may be so pretty, looking pretty and so active. But after the marriage, maximum of women, that prettiness gone away. Lifestyle gone away. Only think about the child and their care. Don't think about their own care. So we are nursing professionals should be educate each mothers. After the childbearing, how to improve your health, how to enrich the mother's lifestyle. Okay, so which is important one for us to improving mother's health in every families. Next section, social epidemiology. Epidemiology. Epi means among, demos means people, logos means scientific study. Meaning, study disease in defined population. Definition, study distribution, determinations, health related status, control diseases and other health problem in defined population, which means particular population, particular definite population, study, keywords, distribution, determination, health related disease and control the diseases. Look at this. This is one of the epidemiological data. 10 leading causes of death in the world by percentage. According to this data, the defined population, 48.2% prematurity. Which means this next. So these are the data. Okay, this is only explain about how what is mean by epidemiological data, which means how many diseases distributed in particular population. An aim of social epidemiology: describe, distribute, and size of diseases. Second, identify etiological factors. Etiology means origin, where that disease causes. Third one, provide data essential. Planning, implementation. Look at this other pie chart express about epidemiological data. In the world, according to 2011, according to this, 7 million people due to ischemic heart diseases. Non-communicable diseases maximum, then second stroke. Then prematurity is less. Then objectives of social epidemiology: study frequency of disease, distribution of disease, determination of disease. Determination means epidemiology, causes. Morbidity, proposition of sickness of specific disease. In geographical locality, morbidity rate, incidence of disease across a population during single year. Which means particular year, how many incidents, new diseases. Then importance of population study in nursing. Students, population study is very important for nursing. First is nursing assessment. Nurse should be assessed demographic, assess the client on the basis of demographic data. When a patient comes into the hospital in IP as well as OP. In OP chart and IP chart having format. A demographic data. Age, sex, education, religion, occupation. These are the population characters. So which help us making good diagnosis, help us identify the causes of diseases and identify needs of the patients. For example, if a patient came from poor background, unable to pay money, that time we can implement the program. Insurance, star insurance, and provide adequate equal nursing services to everyone as well as everywhere. Then care. The care plan determined by population characters, mainly religion of the patient, economic status of the client, not only clinical setting as well as in community setting, for family assessment as well. Then treatment. Population, knowledge of population can use to treat the diseases. For example, to control the treat epidemic and endemic, study the population characters according to implement various programs to control and treat. Then prevention of diseases. Prevent communicable diseases as well as non-communicable diseases. Mainly formulate prevention program. First, study about population, particular geography of population, statistics collected. Population characters should be collected. According to that, we can formulate prevention program. Prevent mental illness, physical illness, also prevent communicable diseases. Sixth one, promotion of health. Promote holistic health, physical health, mental health, and social well-being. The study of population is fundamental for nursing. The nursing management. To manage for better planning, organizing, directing, coordinating, and reporting. The knowledge of population is essential in nursing. The nursing education. Mainly education concerned, we know that cumulative data. Every nursing student, data should be collected and measured. Identify the nursing, the student, the social background regarding their economic, religious. So that data is essential for we can use to student-oriented guidance, as well as implement various government program, minority, as well as the educational incentives. Eighth one, mainly focus on this student-oriented nursing guidance, nursing education can create wonderful nursing professionals. Eighth one, health education. This is mainly concerning clinical aspect as well as community aspect. Health education based on the population characters, depends upon their age, sex, their religion, their occupation, etc. Then counseling and guidance. Also, the population data is fundamental for nursing, for student or this client-oriented guidance. 10th one, nursing research. Student nursing research, population is a vital one. The reason is that population data collection, which age group need for particular research, which class, which means the economic status, and which geographical area. These are the factors need for better nursing research problem formulation, data collection, hypothesis making, research design, then sample determination, etc. Okay. So this mainly this comparative study, mainly this report writing, comparison between high economic status and middle economic status and low economic status, as well as the religious comparisons and sex comparison, male and female, then age comparisons. These are the need for the data interpretation of the data for nursing research. Then apply to all nursing discipline and specialties. As we know that when you read the specialty books, every disease is started with the demographic, social epidemiological data. For example, cardiovascular disease. How much people affected by particular population. How much important to study. And how to solve that healthcare issue, etc. So we mainly the maternal health nursing, child health care, medical surgical nursing, mental health nursing, community health nursing, the population, study of population or knowledge of population is fundamental. So when you read the specialty books, just think about it. These all the terms are available in that book. What are the terms? Population, population characters, population explosion, overpopulation, demography, epidemiology. So these are the concept should be conceptualized and which make better understanding of all other specialties. Okay. Then conclusion. So the study of population studies very important. The concept such as already we have discussed affect or influence the health. For example, overpopulation affect the health and evil effects. It is used as a social medicine, which means if reduce the population can reduce the disease. Also the population data used for every aspect, medical aspect, including prevention of diseases, promotion of health, mainly diagnosis the disease, nursing diagnosis, medical diagnosis, mainly treatment. Every treatment plan based on the population characters. Then apply to nursing. Every aspect of nursing should be think about this. Care, cure, prevention, promotion, rehabilitation, the knowledge of population is fundamental. Then solve social problems. So these all the knowledge used to solve poverty, unemployment, literacy. According to population, only formulate the programs, to solve health allied these issues, mainly poverty, mainly diseases, which caused by other social issues. So population study is essential to promote sustainable peace and health and development. Sustainable peace and development, the study of population is essential in nursing. Then important questions we will learn next class, review questions. So what we had been learned today? Family welfare program in India. The key point is that till 1977, family welfare program named as family planning. After 1977, the name was changed, family welfare. The family planning is part of family welfare. Okay? Then functions of Department of Family Welfare is other area. Scope of family planning and the role of nurse on family welfare programs, etc. Then now discussion time. Pooja Asmita. Pooja.
Yes, sir.
What do you learn today? Main sections. What are the sections today we had been learned? Yes, first section. Pooja, away from where?
Sir.
Yes. Can you see in this screen slide?
Yes, sir.
Yes, first family
Yes, sir.
welfare program. Next section, social epidemiology. Then apply to nursing. Population studies apply in nursing. Which knowledge impresses you? Pooja, which section you like? Family welfare or epidemiology?
Family welfare.
Yes,
Sir.
thank you. It's excellent. You are wonderful nurse. Okay. So, which is fundamental for nursing family welfare program. So, I love it.
Thank you, sir.
Thank you, Pooja. Yes, do you have any clarifications? Anybody? Okay, students. Thank you, everyone. Have a wonderful day. Enjoy the day.
Thank you, sir.
Thank you all. Yes,
Thank you,
Daya.
sir.
Yes,
Thank you.
Blessy. Yes.
Thank you, sir. Thank